Because if you can go into a doctor and you can get them to explain blood tests to you, I want to know, I want to talk to that doctor. I did a residency in OBGYN at Emory University, and you know what we never, ever did? Draw blood to look at hormones. We never did it. We guessed, okay? And we're still guessing. Most people are still guessing. If you were premenopausal, you got birth control pills. If you were postmenopausal, you got estrogen, and you actually got Premarin and Provera, which has nothing to do, it's not bioidentical. And we never tested because the blood does not tell you anything. So I don't care what doctors are drawing blood to look at hormones. I'm going to tell you, I'm going to show you what the textbook says it's useless. And how can I go through a residency at a prestigious university and we were never, ever taught to look at hormones in the blood? And let me tell you why, because again, this is my, I'm harping on this because it's so important. Hormones are made from cholesterol, so they're fat soluble. All right. And so now fat soluble hormones in the blood they will separate out. So it's carried in something called sex hormone binding globulin. And I say they're carried around in a FedEx truck. So the blood is a transportation system. The blood transports hormones from one place to another. But in order for the hormone to work, it has to get out of the truck and go into the cell. And saliva tells you what is in the cell that is attached to the receptor that causes the action. All right. The action takes place in the cell, not in the FedEx truck. The blood is measuring the number of FedEx trucks. It's not measuring how many estrogen molecules got off of the truck into the cell. And then even if you look in the blood, the hormone stays in the cell and it can accumulate in the cell and you don't know it because you're looking in the blood. All right. So Roz, I keep calling you Roz, Rebel.
Yes, it's okay.
Do you am I making myself clear? I'm telling you, it's so many people out there with misinformation. I just have to press upon people how important it is to get good information to get good results. It's just like a computer. If you put in bad information, you're going to get bad results. If you put in good information, you're going to get good results.
Exactly. Now we have a listener in Australia that wanted to say hi.
Hello, Australia.
And we have other questions. We have a question about why do they treat everybody like a cookie cutter on age? You mentioned if you're under this age, you get this, like birth control. And if you're over this age, you get this. Why doesn't anyone question there's a two-parter. It's why do they do this? Because everybody can't fit in the same category. And I lost the question. Oh my goodness.
Hey, well, look. This is what we were taught. I told you before, gynecology made simple. The only thing you needed to know was how old is the patient. If she's less than 40, you give them birth control pills, whether it's irregular bleeding, PMS, what they call PCOS, whatever. You give them birth control pills. But
that's not a one cure fixes all thing. Why doesn't anybody question it? That's the second part.
Hey, now this is what I have to put on the patient. And this is why I say you have to take control of your health. The patients need to question the doctor. That's what needs to happen. Hey, the reason why I learned about this is because a patient questioned me 30 years ago. And she asked me, did I know anything about bioidentical hormones? And I said, no. And so I went and looked for myself to see what was going on. I went back to the textbook and I'm going to show you that. And I know I'm spending a lot of time on this, but I just have to because It's so important.
We need to get it out there. But we have a question Australia's asking. Are you saying saliva hormone levels are more important than blood levels, which are affected by SHBG?
Yes. Okay. So sex hormone binding globulin, like I said, it is the FedEx truck. It carries hormones from the ovaries or from, if you're doing it topically, into the tissue. Okay. It is when it is bound by sex hormone binding globulin, it is inactive. And 99% of it is inactive. And I'll do another podcast and show you this. So 99% is inactive. It's in the FedEx truck. Only 1% is unbound or free to go into the cell. So just think of this. If the amount bound goes from 99% to 98%, and now you go from 1% to 2% that's unbound, now that's doubled the effect of estrogen because it's gone from 1% to 2%, right? But in the blood is negligible. Okay, so let's say now it's gone from 1% to 4%. You're still not going to see that in the blood because it's negligible. It's 96% to 4%, but you have 4 times the amount of estrogen that you need. Okay, now that's so important in the premenopausal woman who comes in with irregular bleeding, fibroids. You go and ask the doctor, okay, I have fibroids. Okay, he's going to say, well, it's because you have too much estrogen. Ask them to draw your blood and to show you that you have too much estrogen. It's going to say your estrogen is normal because it's looking at the 98% that's in the blood. If you come to me and you do a saliva test at the right point of your cycle on day 19, it will show that you have 4 times the amount of estrogen or that your estrogen progesterone ratio is off. So I don't care how old you are. If you come to me and I think there's a hormone issue, you're going to get a saliva test because premenopausally, the blood test is always going to say that your hormones are normal. And that's why we just had to give you birth control pills because the blood didn't tell us anything. Okay, so yes, 100%, the blood is useless if you're going to identify a hormone problem. And I will debate anybody who wants to come on this podcast and debate me on it. We can go at it because it's not about debating me. It's debating physiology. And physiology has not changed. And I've been talking about this for 30 years. If you go to my school, I give you my book. This is how important this is. I'm giving you my book on Are Your Hormones Making You Sick? Okay. I'm giving it to you in an audio book, a PDF, an ebook. And if there's any other way I can get it to you, I'll get it to you. Okay. Before I die. Okay. And I guess because I'm turning 65, I'm just like, it's my, how women, their biological clock is ticking. Well, my lifespan clock is ticking. And I feel like I have a limited amount of time to make sure I get this information out. So I hope I answered the question. If there's another question, that's fine. So that is number one mistake, thinking that women need estrogen. Okay. Now, let me tell you, are there some women who need estrogen? Yes. Women who are either at or below their ideal body weight that don't have enough fat tissue, those women can need estrogen. Okay. But I never give estrogen unless their saliva test shows that they need estrogen. Because 80% of the time, you can just give enough progesterone to get that ratio right, and you will find that that solves most of their problems. Can I move on?
Yes, just touch base that Dr. Taylor is an MD. He's not what is that? The PhD? Yeah. You're an actual doctor.
No, yeah. I'm an MD doctor. Like I said, I did a residency at Emory. Hey, you can go on Google, look me up, put my name up there. You'll see videos of 10 years ago when I was, giving these lectures in front of doctors and patients. So again, this is my life work. Okay, this is my life's work. So now, the second mistake is not understanding the importance of cortisol or adrenal function. And again, that's why we wrote the second book, The Stress Connection. And you can get that at my school platform. I have that in audio book, ebook, PDF. Okay. The Stress Connection. And stress is connected to everything. And so this is how you look at cortisol. Now, cortisol is in a daily rhythm. And it mobilizes glucose, so you have a daily flow of energy. What should happen is that you should wake up. Now, the green area is normal. So you should wake up and you should have a lot of cortisol. And the cortisol is mobilizing the glucose so that you have energy. So you should wake up, you rub your eyes, you wash your face. Hey, I'm awake. All right. And that should be awake without 5 cups of coffee or standing in line at the Starbucks getting your super espresso, whatever. You should have a natural flow of energy. It should be high in the morning. You get a little lull midday. You eat lunch or whatever in order to get some more nutrients. And then you go through the rest of the day. And I don't know if you can see my cursor or my arrow, but if you follow the green, you'll see at the end of the day, then the cortisol should be low so you can go to sleep at night. And you can wake up the next day refreshed. Now, this is the same woman that I did the hormone test on. So this is the same person. Now, she had the stress of her hormones being out of balance, but she also had the stress of taking care of her mother who had dementia. Now, this is common at this age. I've been through it. My mother had dementia the last 5 years of her life. It is a stressful event. It's stressful. So it's stressful on her. And so she's fatigued. She's, she is a working woman. She's dealing with her hormones. So this is her pattern. You see that it's in that light blue. That means it's borderline low. So in the morning, she has a low amount of energy. She has it all during the day. And you see how at night it starts